Innovate to integrate, the path to seamless healthcare ecosystems.
Thank you so much, Olga, for inviting us today to the stage. And also, what I want you to think about today and reflect is that we really need to work together. So whatever is said, it can't be done by one person, but it needs to be done by a team of people. And I want to kick off this conversation straight to you, Carl, if that's okay with you. So, you're coming from the primary healthcare setting. When we think of primary healthcare, we think of the community. And what do you think primary healthcare, what is the role of primary healthcare to really bring about a seamless experience between tertiary, secondary, primary? How does it come, and is there technology involved maybe? I'd love to hear more.
Yes. Can I be here? Hello? Hello?
Yes,
okay.
Go for it, Carl.
Thanks for the invitation. First of all, yes, technology plays a very important part in primary healthcare. However, we need to understand what primary healthcare is all about. Primary healthcare is what glues the whole healthcare system together. We are the frontliners of the first experience we get from the patient. So the patient comes to primary healthcare and gives us his trust to be able to see to his needs. The good or bad of primary healthcare reflects actually on what passes on to secondary and tertiary healthcare. So if we manage to glue the system in place to treat the patient and cure him at that level, then we avoid a lot of cost, a lot of treatments, which the patient needs to pass through, because obviously he goes into an intensive therapy treatment then. So our system is glued together by an enterprise resource planning system, which is an IT system that gives us the resources both from the public sector and the private, because we work hand in hand even with the private sector, to provide information to our clinicians, whether doctors, nurses, or allied health. So it's very important for us to have this data at hand, because obviously we need to see the whole transit of the patient, whether he has test results, laboratory results, radiographic results, and other type of tests. So that is very important. But what is also important is that we need, and we are starting to introduce AI in all this.
Yes, tell us more about it, Carl.
AI is very important for us because we have, as every other country, problem of resources, problem of enough doctors, enough radiologists, enough people on the ground. So AI is a system which we're introducing at the moment on two fronts, one in ophthalmic and the other one in radiology, and that will avoid a lot of pressure on the resources. Apart from the fact that we need to understand that AI is more accurate than any human eye. So it can be the first phase of filtering of results, and then obviously that will need to be reviewed by a human intervention. But for us, we're seeing AI as an aperture where we can increase the services without putting more strain on our internal resources.
Carl, I want to make a link now between you and Conrad, because you've mentioned a really important thing, accuracy. And I think that in order to get there, we really have to link up with research. And that's where Conrad comes in with his deep experience on this matter. And Conrad, a quick question to you. And I think that's the one that I can really perfectly think for you. What do you think is the role of research, all right, in this seamless experience that we're trying to create, bridging and making like a one talking healthcare ecosystem that we really want to bring together? When we had a talk last time together, we talked before, you really said something extremely important, and I'd like you to repeat that. Go for it, Con.
Stefan. Just to put you in the context, I have a role between university as researcher and academia. I also work as a consultant at Mater Dei, which gives me access to studies, which gives me insights on the ground.
That's amazing.
But the most important part is that we are partners with global institutes, where we learn from each other on the practices with which we are passionate about, the research we do. Now, referring to your comments, well, we know clearly how stressed the health systems are. Now, in Malta, we're a small country, and for a long time when we used to discuss in such panels, we used to say, you take the advantage of our size to be able to conduct so many things. But today, now we see it in a different perspective, when we work with practitioners and we work with Mater Dei, St. Vincent de Paul, among others, we find this challenge because people are on the go doing their job and not finding time to do and to take the things to the next level. And digital health, we all agree that that's the possibility to give us this opportunity to make our jobs, our practices much better, much faster, but creates a challenge. Now I see it in such a way that research is not about what happens only at university. Research is everywhere. It happens with those practitioners that not only want to do their job, they want to do a change. They want to do something better. They want their job to be not easier, but more efficient and to be access the latest technologies. We are surrounded all the time when we travel, seeing how different technologies are used. But the question is, how prepared are we for it? Is it just we buy this technology and start implementing it, and after a while we see so many features that we can't handle? So research helps us not only to take it to the next level, but in the process, everybody who's part of it is learning more and understanding more what these tools are all about.
I really like this idea, and the fact you said research is everywhere. And if I had to think about the word everywhere, I would think about Remco. Remco.
Thank you.
You're such a global GP, like a global family doctor. Can you tell me a bit more about your adventure and how even digital health came into all of this?
Thank you so much for the invitation to be here. My name again is Remco Schatz. I'm a medical doctor, global health specialist and entrepreneur. And 1 year ago I founded Enigma Global eHealth because I thought medical care could be better. I worked in a diverse medical settings, from academia as a PhD student till in the field with Doctors Without Borders in Chad. So I actually witnessed all the difficulties and the challenges and complexities of healthcare. And I'm currently digitalizing WHO Yellow Vaccine booklet, the booklet we all have at home. We all lost somehow maybe when we are going on travel.
Yes, of course.
And your question is the key barriers, I think, to the interoperability of healthcare.
Yeah, like how do you bring it all together? You know, how does digital health come into the picture? How can we make it a big step forward? You know, not just a tiny, but a monumental step forward.
The most important aspect is data availability. At the moment, we have a lot of medical systems in the world, and none of these systems are communicating effectively. And if we need to install AI in the future, we need adequate systems that can communicate with each other and that all data is stored in a uniform way. Because if data is stored in all different kind of formats, we will never can use AI for the benefit of patients and doctors. So we need to install more open source, non-vendor locked software solutions. And like, for example, OpenEHR, I'm an industry partner of OpenEHR, is a global non-for-profit organizations who is installing open source software, which is one of the best in the world for data storage in the medical field. And I think that is the way forward. We should push governments, we should push IT institutions and other medical health facilities to use open source software, because this is the way forward, and it needs leadership to do this. It needs leadership to actually push everybody to use this open source software, because if we continue using the IT software from vendor-locked big corporates, then I think we're going nowhere in the world.
I think you're creating here, and this is something very important, that we need to look at the common thread. You know, the thread which will link all the different systems together, so that really and truly we can even document this patient journey and really give them the best possible care. Now, I like to have a bit of a grounded approach in the panels that I'm involved in, and I think the best way to do that is to have a chat a bit with Edward, who is an experienced GP. I also had the opportunity to be trained by him during my medical training years. And my big question to you is this, Edward. Now, of course, you've heard about interoperability, about new technology coming in. We've heard about research trying to bring in the full pathway and ensuring that we really have high quality solutions. Now you, from the ground, from your deep, even like academic experience, I would say as well, because you've managed to not only put the GP, but you also managed to link the academic experience so that we have really high quality health professionals. But what are the practicalities? What makes it real?
Hello. Okay. So thank you for the invitation. As Stefan said, I'm a clinician and also an academic, which means I have the best of both worlds, really. But from the clinical side point of view, we family doctors present a unique perspective. We are the big picture kind of guys. So if a patient comes to us, obviously we have to look at everything under the sun, really, things like back pain, diabetes, depression, all in the same session sometimes.
Okay.
Which also means that we also coordinators of the myriad systems involved in healthcare. For example, physiotherapy for the back pain, psychotherapy for the depression, dietetics for the diabetes. So we have to manage all that, often in the same session. That means we need two very important ingredients: robust patient data and solid communication channels.
Okay.
And we have challenges in both of them, obviously. So the first one, the patient data, as you all know, there are multiple systems where the patient data spread and scattered all along these systems, whether primary, secondary, tertiary, private, public. The patient's data scattered all over the place. And unfortunately, we family doctors often have limited access to most of these data, which means that the big picture kind of guys have only part of the picture. This means often that we have missing patient histories, outdated medication lists, and no mention of the allergies for the medications we're about to prescribe. Consequences: wrong diagnosis, wrong management, patient ending up in hospital, struggling to breathe because of the allergy to the medication I just prescribed. So that's one issue. Second issue is communication. So again, multiple providers spread across multiple sectors: public, private, primary, secondary, and these people as well do not talk to each other, like the systems. No one talks to each other, really. So that's another problem. So how can I coordinate the different resources for the patient in front of me, especially in complex and very urgent situations? This often leads to frustration in doctors, frustration in patients, delayed diagnosis, often also incorrect or inadequate referrals and treatment, of course. And this compromises patient safety.
Now, let's bring it all together. So, it's good that we outline the challenges, but I also love solutions, Duarte. Everyone, I love solutions. So I'm going to put the ball back to you, Duarte, and I'm going to give each and every one of you about 1 to 2 minutes, okay? I know it's a bit tight, I know. But I want to give you 1 to 2 minutes to really highlight, what should be our vision to bring all of this together, to really make sure that the patient, who is the core of our service, patient and citizen, gets the best possible experience. So, Edward, Remco, Conrad, and back to you, Carl.
So, top of my list would be an integrated electronic health records, basically a nationwide, or ideally NEU-wide or even global-wide, but we can start small.
Let's start small.
So it's a nationwide integrated electronic health records, which is available to primary and secondary, and even tertiary, public and private. Otherwise, it's quite pointless. Every healthcare provider would have access to the system wherever he or she is. So if you're at home, you can access it. If you're at your clinic, you can access it. If you're at a patient's home or in your car, you can access it as well. So everything at your fingertips. So I would say that's top of the list, definitely.
Lovely, Eduard, lovely vision. Remco.
At this moment, OpenEHR is already installed in more than 15 European countries, including here in Malta, as you know. And also in many other countries globally, this non-for-profit, non-vendor locked software is readily available and is actually taking over the world as we speak. It's absolutely happening. And they are working now tightly together with FHIR. This is the standard for exchange of medical information. They are now collaborating on a very deep level, combining their strengths. So I think this is truly the future of healthcare. If we all adopt these two global standards, I think then we are already pretty far on the track for patient medical data that will be freely available for doctors worldwide. If you travel, for example, on a holiday and you get sick there, that your doctor there can look into your files and make notes and these kind of things, see your allergies, see your medical history, and add notes. And this is the future. It's absolutely the future. And it's happening as we are here now.
I'm liking this. So we're looking at integrated record, open EHR, FHIR, healthcare standards. Conrad, inspire us.
Well, I think it's very common to understand that we have a challenge, but the solution is basically that we have to have a federated model system, which allows anybody, particularly researchers, to access, but not access by giving the data, rather having a repository where data is available, where services, cloud services or any services related to AI or data management can be integrated through these platforms, and then basically people can work and collaborate within a controlled environment in such a way that not the process of accessing this information, this data, is not tedious or becomes obsolete, or in my case, sometimes in our cases, we end up adopting getting foreign data sets which might not be so relevant for the local scenario. And I think also the standards, interoperability standards, was reading recently in November, Malta already is promoting to adopt these protocols and interoperability standards, which will allow us to enhance better how the data is being managed and shared, not only locally, but even internationally. I think these two solutions are a must now, not an option.
I completely agree with you there, Conrad, for a federated data platform. Because the advantage of it is that the data, even if you implement it well, the data actually stays at the organization.
Yes.
That's the strong part of it, which really results in good, robust health data research governance.
We just need to be in a situation where the problems that the clinicians or the professionals find, they would come, for example, to us, researchers, and when I say to us, not only university, but to entities that do research, they give us the data through this model, and we simply do what we're very good at doing, and helping by providing solutions.
Carl?
Okay. Obviously, I agree with what all that has been said by the other speaker. I would nail it on two things. One being trust. We need to trust our own systems, because quite often we end up building different systems which don't even communicate with each other. We don't share data, so we pass the patient through various tests because he passes from one system to another, and we don't trust what has been done before, and that's not a patient-centered approach, unfortunately. And the other point I would mention is being adventurous. Although we need to preserve data and we need to secure data, we need also to compare our data with other countries for us to improve on our services. Unfortunately, because we think that our data is not accurate, we don't share any data at all, which in my opinion is not something we should do. We should share data even if the accuracy is not high, because unless we start sharing data, that accuracy will never be improved. So in my opinion, we should work in a patient-centered approach, and we should give the patient the best experience by having the services around him rather than having the patient transit from one episode to the other and having to do all the tests all over again. We have started this type of project with our colleagues from Primary Healthcare and Mater Dei, and it seems it's working. So we need to improve on that, and we need to increase the collaboration we have with each other for the good of the patient.
Yes, so a patient-centered electronic health record, which is built on strong health data standards, which is linked to a federated health data platform with strong research governance. And I guess we'll leave you with that. Olga, back on the stage. Thank you very much, everyone, for joining us.